It's not only about fraud, it's also about waste and errors. It's not only about fraud, it's also about inappropriate care and the cost of inappropriate care. It's not only about detecting fraud or errors, it's also about prevention of errors. So our scope is widening, and we are discussing this on a high professional level, and it was really a very fruitful conference.
I think we have to face 4 major challenges. What we need is a common interpretation of the EU law and the way cross-border healthcare is being provided. We need a common definition of fraud and error in cross-border healthcare and all its different forms, and a clear set of sanctions. We need a stock-taking assessment and, if necessary, adjustment of the existing activities. And the last point is we need a EU-funded criminological research regarding scale, patterns and types of fraud.
And waste occurs for a host of reasons, because people don't know better, so errors, because people can't do better. Sometimes the system is just poorly organized. People have incentives sometimes to actually overspend in ways that are not necessary, do not add results to the system. But there's also wasting with intention, which is fraud and corruption and what you mostly talk about. And so we ended up working on fraud and corruption, and what I wanted to try to do is to see how much the lessons that we drew in terms of actions people can take to tackle waste also apply to fraud and corruption.
Healthcare is presumably the most important risk we all have in our daily society. And the problem we have a little bit is that since many years now, healthcare has become a kind of fundamental right for everybody. We all have the right to healthcare, which implies also the right to access to healthcare. And I think this is an important issue we have to look at. Access has a double objective. On the one hand, everybody should have perhaps the right to the best healthcare within the certain limits we all know with our society. And that is, of course, also an issue where we have to look at how is this going to be linked with fraud and waste. Second element, of course, is the rights of the patients in that perspective. And we hear a lot about fraud and we hear a lot about waste, but there's, of course, the issue also of the privacy protection. And in an e-health domain like we know today, I think privacy is becoming one of the most fundamental problems we will have to encounter, and we will have to find a balance between, on the one hand, the combating of fraud and waste, and on the other hand, the right to healthcare and the access of citizens in that perspective.
Fraud can be defined in many ways. Here it is fraud in the health sector as such, and that's why we're very interested in working together with EHFCN in defining what the problems can be, because the aim per se at the end will be to help our citizens and to make it that the money which is frauded on one side should be better used in promoting and making better our healthcare system.
There has been some very interesting presentations that show that we can work together in Europe in clusters, various clusters, one combining, for instance, 2-3 countries interested in data mining, 2, 3, 4 other countries interested in evaluating losses, for instance, etc., etc.
I was very glad that we had serious and strong partners here, like the EC, the European Commission, and the OECD, but also the International Organization for Social Security, named ISA. I think this intensifying the cooperation will be very important for the future, because let's always keep in mind that the whole is stronger than the several parts.